The amount of time that people are in hospital for their assessment varies greatly. That's due to the fact that everyone is an individual and will have had different experiences leading up to admission into hospital. The care team are very keen for you to spend the least amount of time in hospital possible, and from the day of admission we will be working closely with you and your family and carers towards planning a safe discharge.
What we'd expect is for you to be involved in your treatment and care, be part of that and understand what we as a team are aiming to do to support you in your recovery. There are certain elements towards recovery, which the main one being endeavouring to maintain and improve your independence while you're with us.
Your assessment helps us to build a picture of who you are and potential things that may have impacted on your health and well-being, leading up to your admission to hospital. We'll talk to you and people close to you, such as your family and carers, to look at what your normal level of functioning is when you're at home. We may look at things that you enjoy doing, things that are normal to you, because we want to rule out any possible factors that may have impacted on your health and well-being leading up to your admission. From admission, we're going to be working closely with you and your family and carer and anyone else that may have been involved in supporting you prior to admission, such as a care coordinator who would be a community worker who would have supported you into hospital and will remain with you and support you through the discharge process. If there hasn't been anyone involved in your care prior to admission, then we'll make sure that someone is allocated to support you and your family and carer through the journey of admission through to discharge.
We also provide an array of activities that we would like you to be part of, and the expectation is as part of your treatment and working towards your recovery that you will be part of those. Some of those will be particularly tailored to your needs, depending what you are here on our ward for. There are other social groups that we do, which are always good, such as quizzes, bingo. We have volunteers come in, and one of those does Tai Chi, which is a wonderful calming and centering type activity to help you, especially if you're suffering with anxiety in particular.
It's possible to have time on your own. You'll have your own room with an ensuite bathroom to give you a space that you can call your own. But depending on why you've come into hospital, so for instance, if you're withdrawn and normally you're quite an outgoing person, we would encourage you out of your room and encourage you to engage in activities with others. But we also acknowledge that people like to have time to themselves, and having your own room, you've got the ability to do that. We've also got lots of lounges and outdoor space that you can find a quiet space to be on your own.
Obviously we'll have expectations of you as a patient, because it's part of your recovery and aim for your improved well-being. But obviously we also understand that you're coming in at a time of great vulnerability, and even the most simplest things will seem extremely difficult. So that's where the staff come in. They're there to help support you, even making your bed, having a wash, a bath, having your hair done. The staff will engage with you to do that. So gradually building up your confidence, your independence and abilities to take on things in your own right, and that's our aim to work towards your recovery.